What if the problem isn't you? What if you're in the wrong room? My suspicion? You're not broken and you don't need to be fixed. You've outgrown where you are. Let's get more space and freedom to redesign the life you deserve. Welcome to the Reinvention Room. I'm Allison Hare, podcast launch strategist for ambitious leaders, and we are rethinking everything we've been taught. Part pop culture, part real talk, and all smarter ways to live life on your own terms. Can't sleep? Brain fog got you forgetting your own name? Anxiety, night sweats, hair thinning, energy tanking, no libido, weight that will not budge, unexpectedly yelling at your kids, or maybe you're crying over a Cheerio commercial. You might be suffering from being a woman in midlife. Ugh. It sounds like the side effects for a drug commercial while a woman jogs through a meadow in slow motion. Today, I am freaking out excited because menopause is having a moment right now, and perimenopause. And one of the most forefront expert voices is here to help us guide the way. And her name is the one and only Dr. Kelly Casperson. She is a board-certified urologist, best-selling author, and host of the hit international podcast, You Are Not Broken, which, of course, I love that name. And she's on a mission to make sure women stop suffering in silence. Dr. Kelly is that doctor, the one who actually tells you what is going on, how your hormones affect literally everything, and why your symptoms aren't just getting older, they're a solvable medical situation. Did you hear me say that? These are solvable medical situations. Today is the day. You're gonna walk out of here feeling so much better, so much more empowered. And Dr. Kelly is clear, she's fiery, and she's got the science and the storytelling to back it all up. Here is my conversation with Dr. Kelly Casperson. I'm so excited to welcome Dr. Kelly Casperson. Welcome to the Reinvention Room. So glad you're here.
Thanks for having me.
Congrats on your book, The Menopause Moment. It comes out when?
September 16th in America, September 18th, Canada, UK, Australia, New Zealand.
Well, this is really important information, and I had to start in this. The only place that I could start is, how do you get 5 orgasms in a row?
I know, that's like the big myth now. So somebody read the book, they sent me a message and it said, you should, and this was my first book, You Are Not Broken. And they said, you should rename your book. I read your book and then that night had 5 orgasms in a row. You should name your book How to Have 5 Orgasms in a Row. And now like, you're like the second podcast where people are like, you can have 5 orgasms in a row and that's in your book. And I'm like, no, that was somebody's compliment of like what the knowledge obtained allowed them to. So, I mean, I always
those
joke
are
like
pretty compelling results.
yeah, no, that's a good night or a morning or whenever that was. But like, you know, the subtitle of that book is Stop Shoulding All Over Your Sex Life. So it'd be very off brand of me to say you should have 5 orgasms.
Yeah. So your background is as a urologist, right?
Mhm.
Like you're a physician.
Yep.
There are only like 1,000 female urologists in the US. Do I have that
That's
right?
correct. Yeah, you have that right.
How did this all begin? How did it morph into, I
My
don't come
career or why
across a
there's so
lot of
few female urologists?
I think your career and your choice in that, but I don't normally think about urologists. You know what I mean? And
Yeah.
so I want to understand a little more about your career path, but then kind of open it, like kicking the door down around menopause, perimenopause, and coming out with this menopause focused book.
Yeah.
Like this is a
I
really
know
interesting
it's a necessary
trajectory.
question to answer because they'll be like, oh, so I just need to go to a urologist to get hormones. And I'm like, no. Like, back up. So urologists are surgeons first and primarily of the genital urinary system, traditionally male. So meaning the urologists are male, but also male genitals, with the mistaken belief that the gynecologists are taking care of the women's sex lives, which they aren't. Not many of them. And they'll admit to that. So
Huh.
kidneys, ureter, bladder, scrotum, testicles, urethra, all the pieces. And in women, vulva, vagina, clitoris. I did a lot of bladder leakage work, a lot of bladder vaginal prolapse work, so laxity of the pelvic floor. And I was about, I practiced in Washington State. I was about 7 years in. That's the 7-year itch for anybody who has had a midlife 7-year itch. It's real. And I was actually told that in training. They were like, watch out for year 7. Whether it's your marriage or a career, there's some boredom sits in and the existential crisis happens. So like when it happened, I was like, oh, yep, here it is. Like, at least I wasn't like, what is this? 7-year itch is real. And it was really like, you become good at your job, and you say the same thing every single day. And you're like, did I do all of this training just to tell people to pee more regularly and drink more water? I did more than that, but like it gets very repetitive and you get a little bored for like, smart people to get a little bored. And I had a patient come in and she changed my life and I was very bonded with her. I loved her already. So it was a very natural extension. This wasn't some stranger crying, right? This was like, I love you and I don't know how to help you. And does anybody know how to help you? And that was in the realm of sexual health and midlife and feeling broken and loving the marriage, but not loving the sex life. And I was told in urology training, again, because it is a male centric training, women are difficult. We'll never figure them out. Don't worry. The gynecologists are taking care of them. And we're the urologists who give men testosterone and Viagra like every day. Right. And so I like started being like, who's taking care of the people who are supposed to be sleeping with the people that people like me are giving Viagra to? Right. Like, and so I deep dove into women's sexual health. And I was like, oh my God, there is actually data. It's just that it doesn't get to the average woman because Hollywood's wrong, right? Like your parents were probably wrong. Your first boyfriend was wrong. The doctors don't know anything. And I went to a conference, which is the International Society for the Study of Women's Sexual Health, ISWISH. And you have your 10 a.m. coffee and snacks in the hallway, right? When you're at a conference. And a very good friend from medical school was there. And she did one of the top OB-GYN residencies in America. And she's at this conference. And I'm like, what are you doing here? I thought the gynecologists were supposed to know all of this. And they're like, no, we don't know anything about female sexual health. And so female sexual health is what got me into menopause, perimenopause, and hormones, because everybody's like, well, you know what happens to your sex life with menopause? And I'm like, no, I don't. Move on. Well, you know what happens to your sex life with menopause? Well, you know what happens to your sex life with menopause? And it was like on repeat that people, because at that point I had started the podcast, I had started the Instagram, and people were messaging me. And so I was like, what happens to your sex life with menopause? Let's figure that out. What's up with hormones? Why is everybody so afraid of hormones? People don't even know what hormones do. The fear is completely wrong because the data has been debunked, right? And so it was like just peeling the layers of curiosity off of the onion of this like brand new, completely fascinating topic to me. And so like that fixes your 7-year itch, right? Because what do you do when you're bored? Figure out something else to get interested in. And so I got to the point where I'm like, I know enough to write a book about female sexuality, and now I know enough to write a book about hormones. And I really wanted this second book. I think so many books in midlife, they're like, ask your doctor if it's right for you. But what's happening right now because of social media and podcasts and women doing their own reading is They know more than their doctors. And we say that, we're like, sorry, it might be that you know more than your doctors at this point. And now we have to teach you how to advocate for yourself in the doctor's office.
Right.
Because one of the fallouts from the WHI in 2002 that told us to be afraid of hormones, one of the fallouts from that is that doctors stopped learning about it. So we have about a 2-decade moratorium on education, but nothing will make a doctor, because the hormones were dangerous. End of story. Don't question that.
Where did that come from?
The women's, I'm being facetious when I'm being that, but that was kind of it was like, it's off the table. They stopped researching. They stopped teaching. Like the curtain fell down. So the 2002 Women's Health Initiative study is a randomized placebo-controlled government-sponsored study, $1 billion back in the 90s, to ask a very specific question. Is putting older women, average age 63, on synthetic oral hormones, so not the hormones your body naturally makes, will that decrease their risk of heart disease? And the answer is no, it doesn't. Okay. But in that study, they said, looks like there's some more breast cancer in the treatment arm. We're going to stop this. They went to the media. The media took it and ran. The media said hormones cause breast cancer. And the rest is history.
So there's a lot to unpack here. And I think, what you have a really massive platform. You are known as a medical translator. And I
Yeah.
think at this point, there is so much misinformation, disinformation out there. People are getting their insight from TikTok. They're getting their insight from really confident people that may seem qualified. Maybe they have science, maybe they don't. It's hard to discern what it is. And there is a little bit of panic, a lot of panic of, like you hit 45, 50, 55, and you feel like shit. Everything slows down. And we want to feel better. We want to feel like we are empowered. We want to feel like there is support out there. And I'd be so curious to know, like, if there could be some baseline things that we can maybe demystify or like debunk any myths that are out there. What do you hear a lot that needs to be corrected?
In the realms of hormones?
Yeah, I think
Yeah,
in general,
in
menopause,
general.
perimenopause.
Yeah, that you're the classic ones, and men never get this. Men never get this. And the other big reason of why I am so passionate about this is like, just treat us the same. Just treat us all the same. And until you treat men and women the same in the medical world, it's bias and unfair. So women get, you're either too young for this or you're too old for this.
Huh.
Men never get told they're too young or too old for something. It's a completely numbers are like ages for like voting, driver's licenses, right? Like rental
Buying guns.
cars.
Right.
There's nothing for gun ownership. There is nothing alcohol. There's nothing in the medicine that says a age is when you is an absolute iron curtain on having something or not having something.
Yeah.
So risks go up with age. We all know that. But for what I see a lot is you're too young for hormones or you're too old for hormones. So I always joke, like, there's a magical one day of your life where you're apparently the right age for hormones. But that's a big one that I see a lot.
So let me ask you about, I figured, I think I mentioned before we recorded that I posted something on my socials of like, hey, I'm interviewing Dr. Kelly Casperson. What questions do you have? And then everyone was like, and I thought what was interesting is I was like, hey, just comment or DM me. And nobody DM me. Everybody just put it right out there, which I think is good. Like, I think it's good that people aren't trying to keep it close to vest that you have a period and that you, maybe experiencing some things that maybe we felt a lot of shame about, hair loss, moodiness, the brain fog, all of that.
Mm-hmm.
And so I thought we could kind of maybe go like a machine gun,
I love Q&A.
tell me, well, we're just going to go for it. Tell me about pellets. Tell me about estrogen pellets, because I have a lot of friends that are like, I went to this clinic and they, I have hot flashes and now I'm on these pellets. They took away all my hot flashes. I feel great. But I think there's an asterisk there once you start to realize. So tell me about pellets.
Pellets are a way to deliver hormones in any gender, most commonly testosterone and estrogen. The downside with pellets is they're the most expensive way. They're not FDA approved, at least in women. They are. There's a pellet that's approved in men. They're the most invasive. You have to get a little incision, right?
And they insert them like in your side, right? Like under your skin,
like
in
your
your body.
Yep, subcutaneous. So
Okay.
little teeny little. I'm a surgeon. It's not that big. But when I'm like, you want to do this for 40 years? You're going to 40 years? That's your plan? But I think most women don't think of this as a 40 year. They're like, I want to feel better today. But I always joke, like, you shouldn't have to remortgage your house to pay for your hormones. And then the other problem with pellets is if it's too high of a dose, you can't take them out. You just got to wait it out, usually about 3 months. And then number 3, it tends to be the way to get the highest level of hormones. And that's a big shock to a lot of people's systems. And there's a lot more slow, more regulated ways to do that. I see a lot of complaints about hair loss with pellets. And I don't think it's, and then the hormones get a bad rep, right? It's not so much the hormones, it's the rate of change. You went from like nothing to really, really high. Hair follicles hate sudden changes. Postpartum, thyroid, sudden weight loss, stress, massive hormone changes. Hair loss, hair hates that. And so to me, I'm always like, buyer beware with pellets. It is the most polarizing option. People who have pellets and love it, they love it. The problem is they tell all their friends, they go get them, and not a lot of them love it, or their hair falls out, or they have like rage issues, or whatever, issues with high hormones, right? And you can't take it out. You just have to, see you in January. So I think a lot of pellets are there to solve the solution because Western medicine has failed women in this department. I understand why they're there, but people who only do pellets and don't say that there's a menu of hormone options, that's a one-trick pony, and buyer beware.
I gotta go talk for a second. This is going to be like an offshoot, but it's all going to be blended together because GLP-1s are everything right now. And so there are a lot of influencers online that are completely unqualified that are selling GLP-1s. And again, we want to feel better. I'm somebody that, goes to a functional medicine doctor, did the blood work. I'm estrogen dominant and low in progesterone. So I'm on hormone therapy, but not everybody is getting blood work done. And I'm not sure if I'm doing the right thing or if people are kind of just looking for the silver bullet. They'll pay whatever, or, and not realizing, like, if I didn't know I was estrogen dominant and then went and got a estrogen pellet because my friends are saying how much better they feel, it feels really dangerous to me. I'm
well, it's just not the best,
like,
but you shouldn't.
that.
Women are smart. Everything everybody says on the internet isn't right.
It isn't?
Women are smart. Women understand that what might work for somebody doesn't work for the other person. Right. But people get a little entitled that like it should be easy or it should be black and white or we're all Toyotas. Like, no, we're not all Toyotas. We've all got our own, health history. But I will correct you on the estrogen dominance because that's another myth we see. It's used a lot in perimenopause. That is one test on a Tuesday or a Thursday or whatever day you got tested.
Tell me more.
Do not take your estrogen. Do not be telling me when you're 72 that you're estrogen dominant. It is not a fixed trait. It is not eye color. That was on the day of your test. And especially in perimenopause, estrogen can fluctuate wildly. So if you hang on to that label of estrogen dominance, people who know will be like, Allison doesn't know actually what she's talking about. Because you took a day of lab testing and you applied it to your life.
Well, let's talk about lab testing.
Don't do that.
Yeah, let's talk about lab testing. If I went to my general practitioner, my family doctor would say it's all BS, you don't need it. It's going to be fluctuating. You just can never tell. Just do your regular lipid panel and you're fine. Then if I went to, a functional medicine doctor, they're like, you really need it. So help me find where the truth is.
Okay. So the first thing is who's profiting from the labs?
Oh, Okay.
So let's always, your family practice doc makes no money off of ordering labs. So that's actually a nice, unbiased view about profit, at least.
Yeah.
I see a lot of women, they think they have to get quarterly labs. No, unless things are changing. I think labs are useful. And the other thing is labs are validating, right? Allison came to me, she was suffering. I told her no, she feels invalidated. Now, I can tell you as a perimenopause and menopause expert, labs fluctuate all the time in perimenopause. So you have to take that lab. I'll check your labs just to get a baseline to see what's happening today and to validate your concerns. But I'm enough of an expert to know that what Tuesday in May showed is not what Thursday in October is going to show in perimenopause.
Right.
And I didn't do a good job. If Allison doesn't understand that her estrogen dominance is not going to be with her whole life. And estrogen dominance is not a flaw or a dysfunction. That's normal perimenopause ovarian behavior.
It's so interesting because it again, people want to feel better, and the general practitioner will say everything's fine, move on. But are you of the mind to treat the symptoms and not necessarily the labs?
What else don't we treat symptoms in?
I mean, who knows?
You have dry eyes? I'll treat it. You got a rash? I'll treat it. It's incredibly insane to not treat one thing. That makes no sense. Right. And don't give me the natural argument. Erectile dysfunction is natural.
Huh.
Are you following?
But I think so.
People will say, let me back up. people will say, we don't treat perimenopause or menopause because it's natural. Have you heard that?
Right.
Yeah. Dying in childbirth is natural. Femur fractures are natural.
100%.
Cancer is
Yeah.
natural. Erectile dysfunction is natural. Enlarged prostate's natural. Tripping and spraining an ankle is natural. We treat all of it. So
Right.
don't let this myth of natural be why we don't treat women.
And I think that's an important distinction too, of understanding where you have power and where, what is a natural thing. So if I'm thinking of natural,
get rid of that. Get rid of that. Dying in childbirth is natural. Stop using natural as a judgment call. It's called the naturalistic fallacy, and it actually ends up hurting people.
Okay. So, but let's talk about the changes.
So what you might mean is normal.
Okay.
Right?
All right. Okay. I like this. From a normal trajectory, when it comes to perimenopause, menopause, brain fog, weight gain, anxiety, hard to sleep, hair loss, especially the weight gain, the lack of energy, when those happen, it's really easy to hit the panic button and figure out, like, I don't feel like I'm in control anymore.
Yeah.
And then treating the symptoms. How do we know who to go to or how to treat them when the treatments feel very different depending on who you ask?
Yeah. So remember, we have 20 years of nobody learning about this after the 2002 Women's Health Initiative. We have a massive gap in care. We have 80 million women over the age of 40 in this country. We have 1 million physicians and even less nurse practitioners and PAs. We can't keep up with women getting educated and demanding that they actually get care, right? So the first thing, when you get a panic button, that panic button can be improved just by understanding what's going on. This is not a mystery. This is perimenopause. Can you still have other health issues like thyroid? Yes, of course you can, like see a doctor for that. But 100% of women will experience perimenopause. Your only issue is you never saw it coming. Nobody told you about it. You knew what childbirth was. You knew what puberty was. Nobody told you about perimenopause, menopause. So that panic gets accelerated because you think it's a you problem.
Yes.
That you alone have to figure out. Instead of like, hey, it would have been nice if people were like, hey, puberty, childbirth, perimenopause, that's all being a woman. It's the amazing things that our bodies can do, right? Panic goes down just with education. And that's where the book comes in, the podcast comes in, because it's like, it's not a you problem. This is an everybody with ovaries problem, right?
Yeah.
So that helps. And then advocating, getting educated so that you can advocate. We have amazing online clinics now that their only job is perimenopause, menopause. That's great because you actually know, hey, these people are going to get it done for me a little bit better than guessing, somebody on the internet. Go to somebody who's menopause certified. Doesn't mean that they're perfect. And remember, this is not a one size fit all. So people are like, well, my friend Susie is blah, 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 blah. That might work for her. That's not what works for you. And so trust that it does take trial and error and adjustment, especially in perimenopause, because you ain't going to be estrogen dominant every day, my friend. That was on a Tuesday when you got your lab work done. Things will fluctuate.
I hear you, Dr. Kelly.
Right? Good.
I hear you.
Things will fluctuate and you will want estrogen at some point more than likely. But if you're hanging on to I'm estrogen dominant, that's going to limit you from accepting that as a treatment option.
That is so interesting to me. I'm thinking about this is a question I've had forever is brain fog. And so I am somebody who's been late diagnosed with ADHD. And so, me being forgetful, I don't know how to identify brain fog, and not that I'm hanging on to the label of ADHD. I don't feel like it's any different other than, sometimes I get distracted, and I'm bouncing all over the place. So how do you identify what is actually brain fog feel like versus just forgetfulness? Because I think people also hit the panic button of like, dementia. You know what I mean?
Yeah.
It's starting.
So it doesn't mean dementia. We know that. We've got studies. But you have to back up a second because it's hard to talk about these things without people understanding what hormones do. Right? Because you can't understand how hormones are going to help you if you don't understand that these are actually neurocytotoxic steroids, neurohormones that help your neurons function. Estrogen helps your brain process glucose.
Mm.
When your brain doesn't have the right metabolism anymore because the estrogen's gone, it doesn't work as well. So we have to talk about why it's happening because we know why it's happening. But then women are like, I don't know why it's happening. And it's like, no, we know. Listen to why it's happening because that'll help you understand what your choices are.
Yeah.
Right. And one choice is to go on hormones that help your brain function well. And that includes estrogen, that includes testosterone, that includes progesterone. They all work in the brain. The other interesting thing you brought up is ADHD. ADHD is also oftentimes can go along with or be confused for perimenopause because the symptoms are all very much similar. And so it's not uncommon that as perimenopause starts kicking in and you're losing your supportive hormones, your brain starts functioning in a way that's very similar to ADHD. I'm not saying you're not having ADHD. What I'm saying is it's quite common in perimenopause to see ADHD get worse or to see brain things that look like ADHD, et cetera, et cetera.
Hey, it's Allison. Thanks for listening. My guest today, Dr. Kelly Casperson, launched her podcast a few years ago, You Are Not Broken, because she knew she could not be silent about the change she wanted to see. And the good news, it's working. Millions of downloads later. And if you have a message that has been just brewing and needs to come out, I have created a container for you to do just that, strategically, purposefully, and effectively. Grab one of the last spots in my signature private cohort, which I will not be doing again for this year. It's called Press Play Podcast Launch Lab. And you can go grab your spot at allisonhair.com/launch lab. Listen, your future audience is out there. Talk to them. Now back to the show. I'm wondering about like the wild anxiety and then the sleep being so dysregulated.
Yep.
And it feels like it's hard to predict, you know? Sometimes you feel okay, and then sometimes it feels
because you're in perimenopause.
Yes.
Yes. So what's perimenopause? Perimenopause is a roller coaster. It is your ovary trying to stay on the job, but it's getting harder and harder for it to stay on the job. So it's struggling, and sometimes it doesn't produce any hormones, and sometimes it shoots out a whole bunch of estrogen.
Wow.
And that's why people will be like, it was like good for October, but then like November was awful. It's like, yeah, that's perimenopause. Perimenopause is a rough ride. But if people don't know what it is, they start feeling like they're crazy.
I think what I'm hearing is that it's unpredictable,
100%. But that's the definition of it.
Yeah. How do we kind of ride those waves though?
Know what it is. Because you're making your anxiety worse by trying to solve this problem. What is this? What could it be? It's like perimenopause. Happens to 100% of people with ovaries. It's unpredictable. Some people sail through it. Some people, it's a rough ride. What do we know? Sleep schedule. Go to bed at the same time. Wake up at the same time. If you haven't stopped drinking now, you are behind the curve. Alcohol is poison. It's horrible for your brain. It's horrible for sleep. It's horrible for your heart. It's horrible for dementia. It's horrible for breast cancer risk. Stop drinking. This is not the time to start. Exercise. We know that people who exercise, get their heart rates up, have muscle mass, they have less menopausal symptoms. Exercise is brain health, right? So you're trying to support and bring in, if you haven't already brought in these healthy habits, now is the time to be like, dude, your brain is stressed when your ovary is starting to quit on its job. What can we do? So sleep, exercise, mindset, therapy is freaking awesome. A lot of shit comes up in midlife. Fantastic time to address it. Alcohol, knock it off.
What is the mindset? Where can we double click into that? Tell me about.
Yeah. I have a chapter in my new book on it because we know that they've published this. Your mindset about aging, your mindset about what this experience is like actually can lengthen your life or shorten it. It is everything. And if you tell yourself, I'll never figure this out. I don't have any control. I'm estrogen dominant all the time. I don't know what this is. Like, that's a very out of control, stressful way to think,
Yeah.
right? We want to be, the first thing to do is just be aware of it. I tend to catastrophize when I feel out of control. I tend to feel out of control when I'm not sleeping, when I'm drinking, when I'm not exercising, right? It's this awareness of where does it fit in your day to day. I know that when it's a really hard day at work, I don't have any energy left at night, and I need to start saying no to some things, right? So it's gaining control about your life, because ain't nobody else living your life. If you don't grasp these tools and start using them, I mean, and that's what's so powerful about midlife. And it really is an awakening for a lot of people, because it's for the first time, like, you can abuse the crap out of your body in your 20s. You can absolutely ride it hard, have no sleep, and do fine. And midlife is a time of like, if I want this machine to operate well and to take me so I can play pickleball and pick up the grandkids when I'm 73, I need to start prioritizing my self-care. And that really is the reawakening of the midlife that people talk about. So a lot of this is reframing, like this amazing opportunity to really start prioritizing how you want to live.
And
sometimes that means turn TikTok off.
Isn't it funny how we start to rely on some of these kind of dopamine things of just
that's exactly it. It's a total addiction. It's dopamine.
Yeah.
Like they've been designed to keep you on it.
Oh, of course.
Right. And then you're like, who do we go to on social media? I'm like, sometimes just turn off social media.
Yeah. Just go read your book, right? Tell me about protein.
That's probably best. Yeah.
It's probably the only way to do this. Like protein itself is having a moment, right? Everything's got to have protein. As you are aging, you should lift heavy weights. Everything is like cardio really isn't what it was, like lift heavy, get in the gym, and protein. Tell me the validity or non-validity of how much protein do we need? And is it important as part of our regimen?
Well, you have to ask women. Need can mean a lot of things. So what are your goals? Do you want to stay alive? Do you want to stay how you are? Or do you want to build muscle? All three of those things are very different protein goals. So the USDA, what's written on the package, this percentage of protein a day, that USDA is basically like, how little do we need for you to not have a nutritional deficiency? And again, that was created studying young men. Is probably not, we're not all Toyotas, right? So the older body probably needs more protein just as a baseline because of how our body metabolizes it. So understand the USDA is probably not made for a 52-year-old female who just wants to stay on top of nutritional deficiencies. All right, so there's that. Number 2 is staying how you are. Most women are under-muscled, right? So I don't think you're asking me how much you should eat to stay how you are.
Yeah.
And most women want to actually build muscle. Fair? If you want to build muscle, you should probably be doing a gram per pound of body weight. I don't like kg because I'm an American, and people like doing hard math. So in my book, I talk about pound per protein, grams per pound, because I'm like, nobody wants to do the conversion, even me, and I went to med school. Because most women, they say, how much do I need? And I'm like, you want to build, right? Because quadriceps strength is linearly associated to dementia prevention.
What?
Yes. Muscle is literally brain health. Muscle is brain health. You tell your brain that you need muscles to keep going. The brain's like, all right. It's like brain-derived neuro growth factors. There is not a hormone or a medication that is better than exercise.
But you said quadriceps. Is it specifically
your leg
quadriceps?
Muscles. It's one of your biggest muscles in your body.
Wow. This is amazing.
So to gain muscle, you actually have to put on weight. I mean, if you have a lot of fat to lose, right? That's not true for everybody. But especially for like my really thin women who grew up in the 90s or earlier, where thinness was considered wealthy and prestigious, you are aging into frailty, my friends.
Okay.
Period. End of sentence.
Yes.
So if you're not eating to build and lifting to build, you will be in decline. That's just, again, I hate the word natural. That is naturally what happens. And none of us want to go naturally into the ground.
Yeah. So this sounds like a much more proactive approach. I did have somebody who asked me that she's been in menopause for over 3 years, but still experiencing hot flashes. Is that normal?
Okay, back up. What's menopause?
Well, that's you have not had a period for 1 year, correct?
Right. That is the definition of menopause. But is not having a period why you have hot flashes?
I have no idea. You're the
Right?
doctor. Help
That's why we
us.
got to back this question up,
Okay.
because there's a lot
Back
to
it
learn.
up.
Back it up. So, not having periods and the inability to get pregnant is a symptom of what's actually happening. What's actually happening? Our ovaries are stopping production of hormones. Right? We talked about that. That's what perimenopause is.
Yeah.
Right? And then the ovaries stop producing hormones so much that you can't get pregnant and you don't have periods. So what this lady's asking is, I don't have periods. Why do I have hot flashes? And it's like, well, I don't have an elephant in my house. Why is there a dog? It's like they're unrelated things, except for the fact they're both because of low hormones. You following?
Yes.
So why do you have hot flashes? Because of low hormones. Why do you have no more periods? Because of low hormones. So to ask the question, why do I have a donkey in my house when there's a cat outside? It's like, you not having a period has nothing to do with hot flashes should be done or not. They're both because you have low hormones. And how long do you have low hormones? Until you're dead.
Yeah, it's not like it's not like something that rejuvenates itself, right?
No. Yeah, I always tell people, are you planning on getting an ovary transplant? Like, we're not there yet. Right? So unless you want to take hormones to supplement, just like we take insulin and we take thyroid and we take vitamin D and we take, all these things to supplement things that our bodies don't make enough for us naturally.
Yeah.
She will have hot flashes because that's one of her signs of low hormones. Has nothing really to do with her periods ending, except for the fact that they're both happening for the same reason.
Got it.
But what I'm hearing in her question is like, shouldn't I be done with hot flashes because I don't have periods? No, they're both from the exact same thing. Your ovaries stopping to make hormones. And that's the whole point of the book, is like, women don't understand what's actually happening.
Yes.
They think it's no periods. No periods is just something that happens because of the low hormones.
The low hormones. And I'm wondering, somebody had asked about is there any benefit to taking estrogen once it is gone? Like once you're in menopause, is there any benefit to that?
Oh, of course. Why wouldn't there be?
I don't know. If you have HRT, hormone replacement therapy, right? Let's say the estrogen gets lower and lower and lower. What are the benefits of taking estrogen?
Sleep, mood, bone health, decrease hot flashes. Decreases your risk of colon cancer, decreases your risk of breast cancer, decreases your risk of heart disease. If there was a drug, let's back it up for a second. If there was a drug that you could take between the ages of 50 and 60, and several studies have shown it decreases your risk of death and helps you live maybe about 2 years longer, do you think everybody would be on that drug?
Yes.
Yeah.
And that's estrogen?
That drug's called estrogen.
Wow. This is so mind-blowing to me. I need to read your book like backwards and forwards.
I mean, the book really, the book is a response to people saying that we don't have enough research.
Yeah.
And this book is basically like, here's the receipts. This is the research. And in the research in this book is probably like 20% of the research that I would love to actually put in this book, right? But you have to keep it readable and a decent length. But it's like, instead of saying and bemoaning, of course we want more women's health research. Couldn't argue with that on any day. But we need to start using the research we actually have to help the women that we can help now. And that's what this book is. It's like, there's actually tons of research. You just don't know it.
This is amazing. Tell me about testosterone. I think a lot of questions came up over taking supplemental testosterone. And, certainly there's progesterone, and understanding, are there benefits to that as well?
Yeah. Yeah. So the PET hormones, which we now call precision endocrine therapy, or progesterone, estrogen, testosterone, PET therapy. They all have their own little stereotypes, right? Progesterone stereotype is it's great for calming. It's great for anxiety. It's great to help you sleep. The way it gets processed and works in the brain. right? Oral micronized progesterone, very cheap. It's generic and very safe. And most people can tolerate it pretty well. Some people can't. And then there's estradiol, most commonly given transdermal via a patch or a gel these days. There are other ways, but that's the most common way. And then testosterone back it up, ovaries make testosterone. Ovaries can't make estrogen without making testosterone first. Right. So most people don't know that, but you have to get that down before you're like, Dr. Casperson's an expert in female testosterone. People don't even know bodies make testosterone. Right. So we must learn that. We must also know that men make estrogen. Right. We've gender stereotyped these hormones, but it's not black and white like that. So ovaries make testosterone. What do ovaries do in midlife? They stop the production of their hormones. So it's not only estrogen, it's also progesterone and testosterone.
Yeah.
Testosterone's most well studied for libido. Where's libido located in the body?
In the mind. Is that right?
The brain. Yeah. Libido is a mood. Right? So a lot of people notice that testosterone helps moods. A lot of people say that testosterone will help energy, libido. So that's the great stereotype to say it's only for libido and nothing else. And anybody who says that doesn't understand how libido works, right? When does your libido come on? Oh, when I'm relaxed, well rested, feeling positive about life, tend to have more of a libido. Yes. That's how testosterone works. Testosterone works by working in the brain. So it's amazing. I mean, the problem in America right now is we don't have an FDA-approved female testosterone dose. So women are pushed either to pellets or to compounds or to microdosing a male product. Can be done very safely. I have a large amount of happy women on testosterone. Again, doesn't work for everybody, but no medication works for everybody, right? We don't want to be black and white and absolute. There are 4 countries in the world who now have a female dose testosterone product. That includes the UK, Australia, New Zealand, and South Africa.
How do you find the right care and the right dosage? I know that MIDI Health is, I'm hearing a lot about it. I'm not an affiliate of theirs. I think you are. But it sounds exciting that there are very specifically dedicated perimenopause, menopause providers that can treat. But how do we discern what is going to be safe and effective for us? And what to
You have to try
really stay
things.
away from?
Yeah, try things. I always say start low and go slow. Again,
Low
our
and
body
slow.
doesn't like drastic changes, especially hair follicles, right? If you do nothing, let's just talk about, I'll answer your question, but I need to talk about hair for a second. If you do nothing, meaning you just travel through perimenopause, menopause, and you don't take hormones, 50% of women will experience hair loss. It's a massive problem. And so I know that hair is not everything, but let me tell you, hair is a lot to a lot of people. It's a very important topic. And so that's one of the reasons when I say go start low and go slow, hair hates drastic changes. And that's why, like, if you have low hormones and you throw a pellet in, some people might experience
your hair revolts. Your hair just revolts.
Well, I mean, your body's smart. It prioritizes in times of stress.
Yeah.
Right. And you don't need hair to be alive. And so it just doesn't like being shocked with anything drastic because it doesn't know you're trying to put a pellet in, right? It doesn't know you're trying to feel better. So I am not an affiliate with MIDI. I don't get paid. I don't see patients with them. They do advertise on my podcast. I think they're great. And I think they are serving a massive unfilled need in our society, which is women's care focused on treating symptoms of perimenopause and menopause.
That's great.
There's other great companies as well. Evernow, Alloy, Genev. For vaginal estrogen alone, a great one is Interlude. So there's a lot more online because we know healthcare providers are busy. They're tapped out. They might not know everything about perimenopause and menopause. And it's nice to go to a clinic where you know that's what they do. They were created
by insurance. Isn't that right?
Not always. Sometimes.
Not always. Some of them are. What I think is a huge advantage. I mean, a huge progression, from
what would be a huge progression is for insurance to cover all healthcare needed by women.
Yeah. I mean, God forbid. One day we'll work towards it. I have kind of a specific question. I have somebody that is going to be she has the the
Mhm.
BRCA2 gene, and so she is going to uh be in medical menopause.
Yep.
And she's wondering, how bad will it be? I
Why
don't know if
why
you
would
know.
she not take hormones afterwards?
I don't know. I don't know. I don't know what to expect. That's something I don't
The
know.
majority, and I always answer your questions with a question because I want to point out how little knowledge people have.
Yeah.
And when they get the knowledge, they can then advocate for themselves. Because what is this woman doing right now? She's saying, how bad is it going to be? She's bracing herself for hell,
She's young. She's young.
right?
She's in her
Yes.
30s.
What do the current guidelines on treated BRCA patients say? Do
Who
we have
knows?
them? Yes. So that's my whole point is don't just brace yourself for hell, people. Get educated and advocate. It's well published that a treated BRCA patient can be on hormones, aka make you not go into hell, with no increased risk of breast cancer or other
Wow.
cancers. Well published. She
That's
should know
great.
this. Her care provider should be telling her this. She can find this online. Survivors groups know this. Get the education you need so you don't just think hell's coming. Like, it's horrific when you actually sit back and think about this. We
You're
have
probably
published papers on this. We have guidelines on this. There is no reason for a woman to go into surgical menopause and not be allowed to take hormones if she so chooses, without the fear of increased recurrence of disease.
I love that your position on this, but I couldn't imagine the kind of rage you must feel in general of how little we know and how little women have been supported up until this
Yeah, I
point.
mean, the biggest problem for it is the fear. Like, listen, there's tons of shit I don't know, right? Like, I do not expect people to know everything, but for you to live in fear of hell without trying to get out of that, it's a way to control women, and it pisses
Huh.
me off, and it's not okay. What's the best way
Wow.
to control a woman?
Take away her rights.
Yeah, that's also powerful. But okay, so let's go there. What's the best way to take away her rights? Give her fear.
Control her.
Control her. How do we control her? Keep her afraid.
Hmm.
So this education about your body, about the safety of options. Women getting on hormones and controlling like, these women are starting businesses. They're starting new relationships. They're caring for the people they want to care for because they're taking care of themselves. They're sleeping, so they're decreasing their risk of Alzheimer's disease. This is a big effing deal. The amount of suffering out there is profound. And what pisses me off is that women are so satisfied with fear being how they want to live.
Mm. Do you feel like it's how they want to live or not knowing there are options available?
Probably both. Probably both. I mean, there's better options than scrolling on TikTok. I will give you that. But it's like, somebody today was like, I don't know if I want to buy your book. It's $21. And I'm like, you know how much it costs to get your nails done? Like, health literacy, and you can't understand how important health literacy is
Your
until
book
you
is
see
actually
women
very
who,
affordable.
oh my God, it's insane. I just bought
Most of them are $30.
I just bought a
21.
textbook. I bought a textbook for $210. My book's 10% of the price. And the point is
Wow.
that knowledge is worth $210. Like,
Yeah.
health literacy pays itself back in spades. Investing in yourself and understand, because here's the thing about our generation, we're taking care of the frail old people. And we say, what if there's a different way to do this? And we are paying attention. But the women who just say, well, I guess this is just suffering and how it is, like, they will do worse than the women who actually get educated, advocate, try a doctor, try a different doctor. They'll have less hip fractures at age 80. They'll have less dementia. They'll have better sleep. Like, so much is better when you get health literacy. So, I mean, that's the answer is, like, I don't expect everybody to go to med school. Like, I have help with my taxes, right? But I understand that I can get help with my taxes. So I'm not like, oh my God, taxes are just so scary. It's like, no, get
Yeah.
help with them. Like, seek out the information. start paying attention. It's your body. You don't get another one. What else is more important than that?
So I'll ask, I love this, and I appreciate the fire, because I feel like it is a commentary on where we are politically and where we are as a nation and as culturally, which is why this show exists, is how do we change the culture? And it always starts with personal reinvention. And educating ourselves and having people like you on that are fighting for a better world and fighting for us to be empowered and not be broken or not feel like we are broken, because that truly is the fallacy. How can people buy this book, get in touch with you, connect with you? You're really active. You're very fun and feisty and fiery and have incredible insight. How do people get in touch with you?
So I hang out on Instagram at Kelly Casperson MD. I have a website, kellycaspersonmd.com. An events page just went up. The book tour is about 8 cities at this point across the nation. So come and hang out and get a little bit of in-person fire. Book's available now. Any major retailer has it.
Thank you so much for your courage and for putting this out into the world. I don't know if you take private patients still, but it feels like you're really busy kind of educating the world.
Yeah. So I have a clinic. It's called the Casperson Clinic. It's in Washington State. You either have to be a Washington State person because of medical licensing restrictions, or I have people fly in. So I see Hawaiians and Californians. We saw somebody from Iowa. So they have to fly in for that.
Well, I'm thinking even just you carrying the flag for people to get educated on a broader platform, because it is that important. So I want to thank you.
They go in, they talk to their doctor, they get what they need. Then they shoot me DMs on Instagram. So I like this work profoundly matters. Yeah. And people share their wins with me all the time.
Do people message you like, hey, my doctor told me this. Is this bullshit?
All the time. Every day.
I think that if we could
But I get the wins too.
Yeah.
Like,
tell me about
really, really good wins.
Tell me about a win. Tell me about a recent win.
Oh God. Like, the sex wins are like, we've been married for 40 years. The sex is better than it's ever been. Like, that's super fun. Because of you, I started on X, Y, and Z, and I started a new business. Because of you, I can take care of my grandkids. Because of you, I don't have UTIs anymore. Because of you, it just goes on and on and on. It's insane.
What a perfect way to close out our time together. Dr. Kelly Casperson, thank you so much. Go get the Menopause Moment. The book is on pre-order and will be out shortly. But I'm so, so grateful to you for your work. It is important, and your time with us today.
Thanks for having me.
So are you feeling more pissed off or more empowered, or both? I love Dr. Kelly Casperson, and she just gave us the roadmap on how to stop suffering in silence, how to advocate for real care for ourselves and be better equipped, and finally understand what in the hell is happening to our hormones. Her new book, The Menopause Moment, is required reading for all of us. Buy it, dog-ear it, send it to your group chat, do a book review on it or a book club on it. And if you want to connect more with Dr. Kelly, follow her on Instagram at Kelly Casperson MD and check out our podcast, You Are Not Broken. Of course, I will link everything in the show notes. If this conversation had you nodding or rage listening, won't you share this with a friend and leave a quick review? The thing is that the culture changes when you talk about what you find out, what you discover. You talk about it in your own circles and in your own communities, and that is how we change. It helps more women find the truth and find their voice. And speaking of finding your voice, there are only a few spots left in my intimate, private Press Play Podcast Launch Lab, where in only 12 weeks, we will have your podcast not only launched, but also build a business strategy under it so you can grow your network, your income, and your influence and make a real difference. Go to AllisonHair.com/launch lab. I would love to have you and work with you. I'm so grateful for your ears and can't wait to talk to you next time. If you like today's episode, there are several ways to support the show. I produce this show myself, so it helps me continue to make it. First, please rate and review the show on the platform where you listen, and consider sharing this episode with a friend or five. That's how it grows, by sharing these ideas. Second, please sign up for my email where I send out a short personal note to you every week, and always with a sprinkle of snark and some best finds. You can sign up at AllisonHair.com/email. As always, thanks for listening and hanging out with me in the Reinvention Room.